I'm Rebecca Caprio, and this is a project for heart disease and management in Erie County, a community assessment and prevention plan completed by myself, along with Anna Bowie and Bobbie Joe Jackson. Our activity began with the American Heart Association of Western New York. We first traveled to Rochester and participated in the annual Heart Walk and Run, where there was both runners and walkers that participated and provided donations to the American Heart Association in order to raise awareness about heart health, the implications of it, and anything else that can go along with managing health in the community. This was a good opportunity to raise money for this, and also there was educational boosts we assisted in providing education for health, diet, nutrition. UB Medical was there providing health screenings, making referrals for the community. It's a great opportunity. Everything was free to the public and to the runners as well. Moving into Buffalo, we participated in volunteering at the annual Heart Ball, where physicians, their wives, anyone by invitation could participate, where we assisted in raising money for American Heart Association's community-based interventions. Specifically, this one was aimed at Alliance for a Healthier Generation, where they provide summer camp, all kinds of activities for the youth in order to keep health in the forefront in the community and prevent future generations' health complications associated with heart disease. Our diagnosis for the community was high prevalence of cardiac-related deaths in Erie County. Cardiac-related and heart disease deaths are the highest nationally. So this is no surprise that, as well as Erie County and Buffalo, it was number one. Etiologies are related to is lack of health insurance coverage, stress related to poverty and unemployment, as well as inaccessibility to clinics and health screenings, especially during the winter months. Limited resources to provide adequate exercise and physical activity during winter months. The community assessed exhibited several symptoms of these etiologies based on poverty levels, as well as lower income families and lack of accessibility to clinics and lack of insurance as well. The community core of Buffalo is extremely diverse with almost an even amount of white and black race origin. So if you look in the one graph of racial origin, New York State has about a 70% white racial background, Erie County 80%, but in Buffalo it's a lot more of a level field here with 50% being white and over 40% being African American and about 5% being Asian or other, such as Native American. This is important to consider because heart disease is the #1 killer, and it is more prevalent in African Americans, and African Americans are at a higher risk just based on genetics, makeup, and things they pass from generation to generation that put them at increased risk, like hypertension, diabetes that go along with that, which cause heart disease. This is important to consider for our community core because in health teaching, we have that great racial separation there for not like the other states where it's mostly white. We can treat a great amount of people, which is incredible. Social determinants include higher education and high school education rates. Nearly 20% of the populations that are below high school diploma, which also is a cause for unemployment rates because about 25% of jobs require a high school diploma or GED. Not only is it for unemployment, but the lack of higher education can contribute to health illiteracy, and lack of awareness. Health illiteracy is important because you may give a screening and health teach, but if the person cannot understand what you're saying, then nothing is progressing there. So that's important to consider that. Use simple words and make sure that they're understanding before we're leaving them off into the community with high risks. Schools, facilities, they can achieve some of this in the earlier settings, as well as they can face physical determinants to get to screenings in their health care due to Buffalo being wintry. You can't participate in as much. Sidewalks can be covered in the winter, as well as busing can be stopped or put to a stop due to travel bans. The charts here below show what I was saying before. Number one cause of death is heart disease. Poverty status is higher in Buffalo than Erie County, New York State, at about 90%. I'm sorry, at about 30% being below or at the poverty line. Health insurance coverage has been at an all-time high, which is amazing, with only 10% in Erie County being uninsured, either through lack of employment or not meeting the qualifications or just not at all applying for healthcare insurance. Data analysis is 260,000 population in Buffalo, 40% belonging African American, like I said. This is important for medical management and comprehension and proper diet and nutrition. With poverty levels so high, it's important to consider they might not be able to afford some of the recommendations we suggest, like eating organic and vegetables and fruit, which traditionally cost higher than a bag of potato chips. So it's important to consider those. Consider financing when implementing prevention measures and suggesting healthcare management to certain populations. Healthcare coverage can cover some of copay, some of health costs, but it doesn't always pay for food. So that's always important to remember. Core functions and prevention. System review was performed of the social systems in the community's environments. Nursing prevention interventions were aimed at potential risk and disease prevention. With a wide demographic and intricate social system, the community has a lot to offer in both social and business outreach by providing health fairs and public programs. And our recommendation would be for primary prevention to continue supporting these local walks and runs and encouraging exercise and offering healthy foods in the community, healthy drink alternatives other than vending machines filled with soda, things like that. Those are to keep our health where it should be instead of backtracking and working to take off weight, to curb diabetes. We can prevent it altogether. Some incentives for these runs and walks are always fun. People enjoy free t-shirts, free snacks, live bands. Some of the healthcare booths offer, other things like little bags they can take to the market or bracelets, things like that. Secondary prevention would be offering free and local blood pressure screenings and BMI calculations. This can be done by nursing school students as well as residents and other medical staff that are willing to take the time to help the community by screening them for their potential risk for heart disease. These can be offered at home, in churches, in schools. It could be family friendly, and transportation wouldn't be a problem in these instances because often these people are already going to these places. They would not need to go out of their way or take the time. Tertiary prevention is important, as well as primary prevention. By supporting local groups and programs, we can help fight heart disease by encouraging support in the home place after discharge, making sure people are staying on task with their management. They have courage and finding courage in others and seeing success stories and people who survive advanced heart disease. It can keep people going on the right path. References are listed below. Thank you for your time.